Indigenous health is a reflection of the spiritual nature of relations. The self is seen as an interconnected level of being with the individual, community, environment, and spirit, which all exist in harmony within creation and its elements. Turtle Island's unfortunate tryst with European colonization and its underlying Christian ideological rationalization exhibits itself in colonial constructs of governance, socioeconomic, and health systems today. The British North America Act of 1867 defined health services as a provincial jurisdiction and Indigenous affairs as an area of federal jurisdiction. This continues to create ambiguity over Indigenous health across provinces and territories, and much debating about who should pay for health services and in which contexts. The movement towards transfer of control developed into the Health Transfer Policy in 1989, which recognized that Indigenous peoples could assume responsibility and control of resources for community-based health programs. However, there continues to be significant gaps in health operations, services, and outcomes for Indigenous peoples. Change must find its way into and through the complex patchwork of policies, legislation, and coordinating approaches in the Canadian health system. This begs the question, how can health policies support decolonization and reconciliation efforts? Existing programs can be readjusted to focus on enhancing the health of communities through social determinants of health, rather than a siloed system for dealing with diseases, to recalibrate health policy to health in all policies, to support allocation of resources to Indigenous initiatives more effectively, to strengthen research for evidence-based decision-making and do so with an Indigenous epistemology and research methodology, and to build trust and improve knowledge sharing between all stakeholders. The state of affairs in Indigenous communities are a product of long-term sustained colonial investment. Therefore, it requires at the very least an equally sustained long-term investment by society at the most fundamental levels to re-access and reclaim Indigenous identity and worldviews and impact all aspects of life, including Indigenous health.